Our next speaker is Dr. Victor Marcial-Vega. He is a graduate from the University of Puerto Rico Medical School. He completed his internship and residency at the Johns Hopkins Hospital. He is board certified in Radiation Oncology. He has been a clinical assistant professor at the University of Miami School of Medicine and director of Health Horizons Alternative Medical Research Center in Coral Gables, Florida. He currently practices in Puerto Rico and is involved in the use of EDTA, ozone therapies, phospholipids, intravenous vitamin C, mind-body techniques, and integrative medicine in the management of cancer, autism, viruses, and other diseases. Among his affiliations was President of Medical Disciplines Council of the College of Physicians and Surgeons of Puerto Rico. He is the author of Rejuvenation Protocol, a nutritional medicine guide for effective healing, and has contributed to several other books and medical publications. In 1999, he testified before the Government Reform Committee in the use of EDTA chelation therapy in the management of cancer and cardiovascular disease. He received the Clinical Fellowship Award from the American Cancer Society and the Lifetime Achievement Award from the Academy of Comprehensive and Integrative Medicine. Please join me in welcoming Dr. Victor Marcial.
Thank you.
Thank you.
Thank you.
Although I don't have any financial interest of a product with any company that supplies us in the office, I do sell products in my office, and we do charge for our intravenous therapy. Okay. So I'm very excited to be here. Thank you for this wonderful invitation. I always enjoy coming here and talking to you folks. And I dedicate this also to my patients because 25 years ago we didn't have as much information as we have today. We have a lot of information that we've seen over the last couple of days, but 25 years ago there wasn't as much available. And thanks to the patients, I will bring anything from a bottle of Letril to a bottle of vitamin C and all the things that they push me to look at and evaluate. So I thank him greatly for all these things that we found. And I'm going to talk today about how are we in Puerto Rico and when we were in Florida managing cases of neurodegeneration. So you can have an idea of how we do this and what to expect and how to monitor them. And as you know, the planet is not an isolated entity, country or country. Everything is a whirlpool that is mixing around. Unfortunately, we have something called petroleum products, and that's the main toxin that we find in the environment. And we're going to talk about the causes of these neurodegenerative diseases that are becoming epidemic. Do you know now that the #1 cause of death in England is Alzheimer's disease? In Puerto Rico is the #4. It used to be 17 a couple of decades ago. So also the rates of autism are still going up year after year. And in great part is from pollution of the environment. It's not genetic. We didn't used to have this in the 1980s. This is a surge in neurological diseases because of petroleum byproducts in great part. And pesticides. This is a sign in a pesticide farm. Danger, pesticides, keep out. Would you eat something that has a sign put in next to it that says, danger, keep away from this? This is one of the most important slides that I have found because when I was looking 25 years ago after my mother died of cancer, I dedicated myself to finding out the cause of cancer, what's causing cancer. And I thought that going to radiation oncology at Johns Hopkins will give me that answer. Wrong. They have really nothing to do with finding the cause of cancer, but rather treatments for cancer. So little by little, I started getting sick myself. When I was 33 years old, I started getting a severe arthritis, stress, and none of my doctors knew what to do with me. They wanted to give me medications. But then, after a psychiatrist that I ended up with finally gave me Xanax, my arthritis of 3 years went away completely. And I realized that my stress was causing a lot of problems in my body. And that's what started me on this journey. If it wasn't because of that stress and that arthritis and that Xanax, I never would have pursued all these other things. So I started looking into this, and now a report came in 2010 commissioned by President Obama. That data was sitting for 8 years under President Bush, but was never published. The three entities that co-wrote the study, which we see here, down here, and you can ask as an American citizen, as a North American citizen, you can ask for this report, go to NCI, National Cancer Institute, the 2010 President's Cancer Panel report, they'll send you a copy, 250 page. It's really worth getting, and I'll tell you why. The report is also downloadable, you can download it, and it was written by the Department of Health and Human Services, the National Cancer Institute, and the National Institutes of Health, because President Obama asked them, what is causing cancer in the United States? I want you to give me a report. And they said, Mr. President, the overwhelming majority of cancer, we cannot give you an exact number. It's maybe more than half, maybe more than 2/3. We're not sure. But the 80,000 chemicals in the environment, most of them petrochemicals, are probably the cause. Less than 5%, this panel said, is due to genetics, like Scleroderma pigmentosa, Ataxia telangiectasia, and similar genetic disorders cause cancer. So the report in one picture says, we're going to put it in a picture, Mr. President. And this is a picture of the 4th page of the report. And these are the main causes of cancer in the United States, according to that report. Pollution of the air, the water, pesticides in the food, and x-rays in hospitals. You don't see genetics there. So that justifies and endorses the protocols that we do to remove these toxins from the bodies of the patients. But this is not only for cancer. Because I'm an oncologist, I started with cancer. But then I started seeing in other patients other responses. And in cancer patients that had other diseases, responses to removal of toxins from their bodies. Now we have integrated medicine centers in virtually every academic center in the United States. As you can see here, and all of them have one, but unfortunately, they limit themselves to massage, nutrition, acupuncture, psychotherapy. They don't talk about the real nutrition, real detoxification that we know we have to speak about, and dental health. But it's getting better. And as you know, integrated medicine recognizes the environmental role of toxins as a cause of diseases. And petroleum-based products, plastics, pesticides, heavy metals are major culprits in this. So the causes of disease, if we could summarize them in 4 categories: pollution, stress, poor nutrition, lack of exercise, all lead to a decrease in electrons. That's the common denominator. Mercury wouldn't poison you if it didn't rob your electrons. The ultimate electron stealer is cyanide. So anything that shuts down the system, lowers the amount of electricity, and pollutes is a culprit. Now, lack of exercise is interesting because did you know that randomized studies have shown in breast cancer patients that exercise cures breast cancer? Those studies were done 15, 17 years ago. Several studies, not just one randomized study, but many randomized studies. It showed that it produced not a relative, but an absolute survival advantage of 5 to 10%. Chemotherapy, in most cases, gives an absolute survival advantage of 2 to 7%. You see the comparison here? So unfortunately, now you try to go in the internet to look at those studies, it's very hard to find them. But we're starting to find them in websites in Europe. European governments are putting all that information out, so that's a good thing. And we recommend exercise for all of our patients 4 times a week, walking 45 minutes. And I recommend you do the same. Now, these are survival advantages, so that means more cure for cancer and other illnesses. So that's very important. Now, I don't know if you're aware of Dr. Bredesen. Dr. Bredesen wrote a book and has written more than 400 articles on the multimodal cause of Alzheimer's. He says you cannot just get a pill for Alzheimer's, you have to address all these issues. And these are only some of the issues. So the environmental, genetic, nutritional, emotional, psychological, mental, lack of exercise, medications, other medical conditions, everything has to be addressed. But he's seeing reversal of the dementia in these patients in the last 25 years. He's tried to put this in NIH protocols. They don't accept them because it's not one thing. It's too many things, they tell him. But he's seeing the results, and we've been seeing the results over the last few years when we address all of this. Now, mind you, in Puerto Rico, we have not been able to do all the studies that we would like to do in Alzheimer's patients, like heavy metals and other things, because they would cover 24-hour urine analysis in the early 2000s, then they stopped covering. Now, fortunately, they're starting to covering it again, so that's a good thing. But other studies, not all insurance companies cover. So we've been forced to do this initial workup program. CBC and differential, complete metabolic profile, vitamin D, and lipid profile. We do that with everybody. We try to do the 24-hour urine collection with EDTA challenge, and I'll show you why. We've seen heavy metals present in 100% of the population. Initially, we thought that Alzheimer's would respond well to chelation, and it does, but in very early stages, because practically everybody in Puerto Rico that gets an MRI of the brain has chronic microvascular changes in the brain. But somehow that is not addressed. It's diagnosed, but not addressed. And of course, that means that there's deposits of cholesterol in the arteries, hindering the circulation to the brain. So they're candidates for chelation therapy. And you are aware of the TAC study, a randomized study for EDTA chelation therapy done by the National Institutes of Health. We're 1,700 patients. Half of the patients after a first heart attack went on to weekly chelation for 2 weeks, and with or without medication. The other half, only medication, without chelation. And the results were statistically significant. The ones that got chelation did better in lower mortality, lower incidence of admission to the hospital, less need for medications, less need for bypass surgery, less need for stents, and less incidence of a second heart attack. We've seen that. We've seen how chelation, we couldn't say it 20 years ago, but we can say it now. Chelation therapy can open an artery that's being clogged by cholesterol, that's been obstructed. So that's something that we thought would work with these patients initially. And as you know, Huggins found that parts per trillion of mercury or any other heavy metal is significant in the production of disease, including heart disease. Dr. Levine has mentioned that none of the patients that had a good oral health and addressing all the issues in the mouth had a heart attack if they had those issues addressed. So it's a very strong correlation between oral health and heart attacks. We did 24-hour collection in the most contaminated population that we have in Puerto Rico, which is Vieques. Vieques is where the Navy practiced shooting for 60 years before they left. So we went there and did a project. We didn't charge anybody. This was free for 28 visits that we did, 28 treatments, and we did it over a 1.5, 2 year period. And we found in the 24-hour urine collection in these patients, measuring micrograms of the metal per gram of creatinine in the urine collection, 100% of the patients had lead, 100% arsenic. Oh, sorry, let me see here. 92% aluminum, 65% mercury, 98% cadmium. But look at this, 33% uranium. And as you know, they practice with uranium-tipped projectiles that can penetrate armor easier. but of course the population has evidence of that, we believe is that uranium. So pre and post EDTA calcium 24-hour urine is the best comparison to see how much you find before you do the 24-hour urine provocation and how much you get afterwards. So you get both diagnosis and treatment options with these two tests. So we do the pre, for example, lead, just to show you how much the body will hold on to the heavy metals. We have a lead level of 1, pre-chelation, and post-chelation it was 62. So 60 times the amount of lead that came out after chelation. So chelation therapy is excellent to remove heavy metals. And even though it's not historically the standard for mercury removal, it would also increase the excretion of mercury, as we can see here. Aluminum from 0.131 to 77.4. So that's indication that it is a potential therapeutic agent. Conventional medicine discourages this provocation because they say it makes the patients more toxic, but they recommend diagnosis with blood, but blood will give us more of an acute exposure, so we don't recommend that. We recommend 24-hour urine. So in the beginning, we would manage patients with 3-hour infusions of EDTA. We use a bag that had 250 to 500 cc's of either sterile water or Ringer's lactate. We would add vitamin C, chelation, EDTA sodium. We would add other minerals, and we would do the 3-hour infusion. I started comparing with some people in the literature that were doing IV push with EDTA calcium. It's a different EDTA. And that can be given the same amount in 5 to 10 minutes. And it's safe to the patient. And what I was finding is that patients were getting better results than with 3-hour infusions. So now in the last 7 to 8 years, I haven't done any 3-hour infusions. It's all IV push of EDTA. So the patients in Vieques that were treated with IV EDTA. So from 2010 to 2016, we treated 493 patients with this EDTA calcium with a dose range of 300 to 3,000 milligrams. Median age of the patients was 57. This is a retrospective review. It's not randomized. It's just a view and a description of our experience to see what did it do to the patients. Did it help them? What were the side effects? More than 7,500 procedures were done. The infusion is done once a week. And if you do this once a week, after 6 weeks, you should do again the testing, the CBC, the CMP, and the lipid profile. Because the patient will see it, you will see it, make sure everything's okay, make sure that the kidney function is improving, make sure that the hemoglobin is getting better, make sure that the white blood cells are improving. You're going to see a lot of things improving in many of the patients. So you want to monitor that every 6 weeks, every 6 treatments. If you do it twice a week, it will be 3 weeks. If you do it once a week, which is what we recommend for most patients, it will be every 6 weeks. And what we found was the following: a lowering of the total cholesterol in 85% of the patients, lowering of glucose levels in 92%, disappearance of joint pains in 95% of the patients, regardless of what kind of arthritis they had. And the most common, more energy and sleeping better, 100% of the patients. So we've heard that underlying comment throughout the lectures in the last 2 days, that energy and sleeping are associated with not only mercury, but other metals' presence in the body. So removing those metals will improve a very common symptom that we see in our patients. And also, in one patient with pituitary adenoma, not only the adenoma went away, but the calcification of the pineal. The pineal gland produces melatonin, but also is being said to be the gland of intuition, of high spiritual awareness. So it's being said too that all the chemicals in the environment are promoting the calcification of the pineal, so it doesn't work properly. And by the way, spirituality is probably the most important underlying unspoken thing or theme throughout this conference, because we rely a lot on that. We have to take all the data that we see from our fellow scientists, basic scientists, and try to put it together in the clinic and then see how that works with our patients and do it in the simplest way possible. And this is what I'm attempting to do here. But the decalcification of the pineal gland definitely seems like a good thing, and we're in the process of studying that further. So what I meant by the spiritual portion of it, and before I get into this retrospective review of whether detoxification made any difference in my cancer patients, one of the main things that I recommend you tell your patients is that as they start feeling better from the things that you start doing, that's the main reason why the treatment gets worse. That doesn't make sense, right? What I just said. So the main reason they're getting worse is because they were getting better. That doesn't make any sense. Many of my patients come to me after 2-3 weeks of treatment. They were feeling better, and they come one day, this is not working. I'm worse than when I started. And I said, let me ask you a question. The day before you crashed, what do you do? And he said, nothing, the same as usual. No, what do you do? Well, I went shopping. I haven't been shopping in years because I haven't felt good, but I went shopping for 3 hours. Okay, what else do you do? At night, I went home and I cleaned the whole kitchen. I haven't cleaned the whole kitchen in years. Okay, what else do you do? I painted one wall in the living room. Okay, so that's why you crashed. I said, you're right. I had so much energy. The last thing in my mind was physicians. The last thing in my mind was my doctors, my medicines. I said, that's what needs to be told to the patients. As they get better, they have to treat themselves as if they're sick. They have to be in bed sometimes, complete bed rest, not spend their whole energy because then they're going to crash. So that's where the spirituality of every patient comes in. They have to become aware of themselves to help you with this process because otherwise they can sabotage themselves. So we managed 40 patients that had failed cancer therapy with a protocol of things that I saw in the literature. I didn't come up with any of this. I was reading the little bit that was available in the 90s, late 90s and early 2000s, of things that supposedly removed the toxins from the body. Because although the President's Cancer Panel report came out in 2010, we have known this group have known this for 20, 30 years or more. So there has been evidence, other evidence about these things. Maybe it's not the authorities, like in this case, those 3 entities in the United States, but yes, we've seen that. So I added a protocol that included nutritional supplementation, intravenous vitamin C and chelation 3 times a week, ozone and hyperthermia showers every day. The vitamin C that we used was 20 grams starting. We would increase it by 20 grams until we reach 100 grams of vitamin C. 100 cc's. 50 to 60 grams of vitamin C at this time. We were using that amount. In sterile water with EDTA added 2 to 6 cc's. This was EDTA sodium at the time. 3 times a week of intravenous therapy and gradually increasing it until 70 grams is used at the present time. Ozone hyperthermia showers every day. There were 40 patients that we looked at and a median follow-up of 18 months. We did this program for 3 weeks, but some continue for longer, and some will do it once a month, some every 2 months. But we looked at the initial tumor response after the 3 weeks, and we found the following. We put a cutoff point that tumor response meant that the tumor shrank at least by half. If it shrank by less than half, we didn't consider that a response. So it had to be 50% or more. And the overall, as you can see down here, the overall response of detoxifying these patients was 72%, which is very promising considering these were heavily pretreated patients, many of them with stage 4 disease. But this did not last. And we know that. We know that all our patients have to go into a program for life because we still have a polluted planet. Whenever we achieve a planet that's not polluted, then we don't have to do the things that we do. But right now, because we're in a polluted planet, We need to put him in a maintenance program. So there was no plan for a maintenance program, and of course, many of them will regrow the tumor because we didn't continue the program. And at 18 months, the results were different. The results went from 70-something% to 42%. Something that we would see in this protocol is that symptoms improved within the first 2 weeks, tiredness, pains, insomnia, and other things that they were complaining about, arthritis, and it was sustained at 5 months in 50% of the patients. Memory and awareness. We were not looking for that, but most patients reported an improvement in cognitive, memory, and focusing. So this was an indicator of a possible correlation between toxins and brain function. And just to give you an idea, this is a patient with a metastatic endometrial cancer to lymph nodes in the pelvis. The lymph nodes you can see on each side, here and here. This is a lymph node. This is a uterus. This is the bladder. And this is the enlarged metastases. And after this protocol, the metastases has gone down considerably, and this one as well. As you can see, they have gone down. Patient with metastatic colon cancer to the lung, you see the metastases here and here. And after the protocol, he has gone down, as you can see here. Patient with a stage 4 lymphoma, HIV positive. And as you can see, everything that you see white here, this is a tumor mass. This is extension into the fat, which is dark. You don't see as much dark. So the fat has been replaced by tumor, which is the white. See all this white around this area in the abdomen, white. That's tumor, white, white. And 4 months later, you see the fat, which is the dark. You see the intestines clearly. The patient is in remission. And he's been in remission until the beginning of this year. So it's been since 1996, he's been in remission. So these protocols are not as effective for neurological diseases, although if we see a patient with Alzheimer's with circulation problems, either by MRI evidence or by increased cholesterol or lipids, we'll do the chelation therapy. But detoxification doesn't seem to be enough, and tissue regeneration had to be addressed. So we started using phospholipids, specifically phosphatidylcholine, which is more than 50% of the cell membranes of the body are made of phosphatidylcholine. But we assume that when we give omega-3 and omega-6, we're producing phosphatidylcholine and phospholipids. But unfortunately, what's causing the problem of Alzheimer's and other diseases is also causing that reaction not to happen. So just by giving omega-3 and omega-6, which we did for years, wasn't doing anything, but when we started giving intravenous phosphatidylcholine, everything seemed to change. In addition, we're using, in these patients, phenylbutyrate, crosses the blood-brain barrier, and can calm a child with self-mutilation symptoms in minutes. So it removes inflammation rapidly in a patient, and can resolve headaches in migraine patients within minutes. So it's an adjunct in detoxifying the brain. Patricia Kane did a lot of this work with phosphatidylcholine, glutathione, and methylcobalamin, and reversal of neurological symptoms, doing sometimes the protocol 3 times a day in patients with ALS. So more than 85% of Alzheimer's disease patients will have this MRI finding of white matter changes consistent with small vessel ischemic disease. It's the 4th leading cause of death in Puerto Rico and the 6th leading cause of death in the United States. Besides the monitoring that I recommended you to do in the beginning with these patients, the next of kin is the most important monitoring. They'll tell you if the patient is getting better or worse, whether it's the mother of a kid that has autism or the wife or husband of somebody with Alzheimer's disease. Monthly neurological cognitive testing, this is not always possible, but we try to do it. And the salivary pH 3 times a day, that's probably the most important monitoring. How many of you do saliva pH in all your patients? I do it in all my patients. They get a kit the first day. And I tell them when they ask me, what should I eat? And I said, I don't know. First, you have to know where you're at. So I tell them to do the pH before each meal and write it down and make a table of pH and the meals that they're having. So if they do a pH before lunch and it's acidic, in general, that corresponds to the breakfast. So breakfast didn't help them get alkaline. You want to get alkaline. Acidic means loss of electrons. Alkalinity means the battery is charged. So that's what you want. Some patients tell me they're alkaline only in the afternoon and at night. So those patients usually have root canals and other cavitations that make them acidic in the morning because there's less saliva at night. And that's almost a dead giveaway that there's something going on in their mouth, although most patients have something going on in their mouth, as we see. So the salivary pH will help them decide what foods are the best for them. And in general, more vegetables. And I also tell them all to chew 30 times. If they don't chew 30 times, they're wasting their money. It's going right through them in terms of vegetables and fruits. So chewing is very important. This is probably the most important thing I can tell my patients, to do the saliva pH and chew the vegetables 30 times. And I'll show you which one I recommend so you can order. It's from Mercury-Safe Laboratories in New Jersey. And the blood work and an MRI scan of the brain every 6 to 12 months. Now, I recommend 4 supplements. I make it very simple to my patients. I found that these 4 supplements, goji berry, chlorella, vitamin C, and probiotics. And if you cannot find goji berries, you can substitute that with digestive enzymes, and it will have the exact same effect. These 4 things will have the effect of alkalinizing the patient through detoxification. So that I put them on these things for 2 weeks before I do any other procedures, to get the body ready, the bowel movements moving, the intestines ready for the detoxification that's coming next. So those 4 things is the first thing we recommend. Alkalinizing program, but there's no list. There's no such thing as a list, because we have our own unique idiosyncrasy as individuals. I have people that can eat a lot of fruit and become alkaline, but most that eat a lot of fruit will become acidic. So there's a lot of exceptions to the rule that I want the patients to discover. So I give them those 2 weeks to get familiar with the pH and the relation to the food, the stress at home, how they slept the night before, and whether they're exercising or not. And then they start seeing the connections. They don't have to take our word for it. And then 2 weeks later, we used to start intravenous phosphatidylcholine, 250 to 1,500 milligrams IV push, or in an IV bag. Methylcobalamin and glutathione, weekly. Now, I'll show you what else we started to do with the patients in a little while. If a patient with Alzheimer's is still talking and still walking, he has a good chance of recovering. If they're not talking or walking, chances are almost 0. And the pH paper I recommend is the one that goes on the range of 5.5 to 8.0, Mercury-Safe Laboratories in New Jersey. Do before each meal. If you do it after a meal, it's a totally bad result. It's not accurate, because you're going to have an alkaline rush, and it's going to look great, but it's not great. You got to do it before each meal. Chew the food 30 times and do a table of food and saliva pH. Another technique that we use is the pulse electromagnetic frequency. And the pulse electromagnetic frequency, PEMF 100, is a device that I was trained in. It detoxifies the cells by attracting electromagnetically the toxins, reduces inflammation as a result of that, and increases circulation as a result of that, increases the cellular nutrient uptake, and promotes stem cell formation without injection of stem cells, without invasive procedures. And this is the machine that we use, the one that is, there's a desktop version and there's a carry-on version. We have the carry-on, but they're exactly the same in terms of components. The references I recommend that you read them. There are 500 references, but they're abbreviations and abstracts than anybody can read, a scientist as well as a layperson. And they're put in alphabetical order by condition. So it's a lot of eye-opening experience to read those peer-reviewed journals. And you're just reading a minute of them, but you're getting the gist of the situation of how PEMF can help you. For example, this was invented by orthopedic surgeons that could not heal bones, whose patients could not heal the bone. Either with surgery and IV antibiotics, the bones will not heal. These patients were given pulse-electromagnetic fields, and close to 90% healed. And that's how this started. They did biopsies of the callus, and they found the biopsy was full of stem cells in different stages of differentiation of bone cells. So that's how this started our curiosity to use it for other things in the body, in other parts of the body. So you can read some of these references in those, in that 500 reference internet access that I gave you. And they also have a reference for Alzheimer's disease where there was an improvement of visual memory and visual constructive performance. Now, we're starting our patients now with pulse-electromagnetic frequency. Patients with Alzheimer's get 5 minutes a week, then the next week 10 minutes, then the next week 15. And this we will do routinely for all the intravenous pulse-electromagnetics or microcurrent that I'll mention next. We slowly increase week after week the dosage. And in very frail patients, we would add one thing at a time. So we go slow, adding one thing at a time so they won't have side effects of a major detoxification. Inspire Start is a device developed by Edward Kondrak in Florida, where he's using this for reversing macular degeneration in his patients. And I've seen that with our patients. We got that training, and that also is similar to pulse electromagnetic frequency, but it's a current. It's a microcurrent. You don't feel it. So it's different than the TENS that the orthopedic surgeons use where you feel it, and that is burning tissue. This is regenerating tissue because it's a microcurrent, not a macro current. And the regeneration of tissue is what we're looking after. This is the setup. You take those gloves that are impregnated with silver fibers, surround them with a wet towel, and put the wet towel in the forehead and back of the neck of the patient. And we give the sessions, and that also has been shown to increase permeability of substances in the brain in and out. So we do Alzheimer's disease with PEMF in the head once a week, 5-30 minutes, microcurrent once a week, phosphatidylcholine, glutathione, and methylcobalamin. That's basically the protocol for these patients. Of 25 patients that we treated initially, there was marked improvement in 72% of the patients. 2 had no response and 20 had moderate response. Now, initially, these were patients that were treated only with phosphatidylcholine B12, sometimes with and without chelation therapy, and glutathione. But fortunately, when we added the pulse electromagnetic frequency and the microcurrent, this has gone to 87% improvement. One example is a minister that had to stop ministering in the church because he would forget what he had just said in the sermon. So he would do something in the sermon and he would forget what he just said, and he would just get totally lost and had to stop working. He couldn't read anymore because he would read and forgot the previous paragraph. So that was a very sad situation because he was forgetting all the short-term memory that makes us enjoy life and enjoy all these things that we do, and sometimes being able to do our work. So he started this program 5 years ago, and he has, to this day, he's preaching completely normal. He's back to normal completely. He's in a maintenance program once every month. He gets this in an IV for an hour and a half. So it's not an IV push. It's a higher quantity. And he's recovered all the cognitive functions. And now he's reminding his wife that used to take care of him of the things that she's forgetting now. So now she's getting in the program with him. So this is a protocol that if you have a patient that needs regeneration fast and they're still walking and talking, there's a good chance that it'll help them. Prognostic factors are age and performance status. Performance status I already mentioned. Age, when they're in their 50s or younger, that's a specific age, is a very poor prognosis. Almost all of them go rapidly to deterioration within a year and death. I've never seen anything like it. I've seen it in Puerto Rico. The ones that are between 60 and 70, they call it dementia, but it's based on age. It's probably the same as Alzheimer's, a multifactorial situation. But the ones that are really young, they don't do well with this protocol. So if they can carry a normal conversation and walk, they have a more than 90% chance of responding. If not, they have a more than 90% chance of not responding. So that's very important to decide which patients should go in a protocol like this. 10 patients with dementia have a very similar result. Dementia is just a cutoff point of age, so it's not a big difference. With Parkinson's disease, we don't see as much of a good result, so I'm going to try some of the things that I've heard in this conference and get the training course. But of the patients that we manage this way, half of them have gotten better. The other half have not responded and have continued to progress. Herpes zoster neuropathy. When we saw those patients, we used to treat them with vitamin C intravenously and hydrogen peroxide, but we did not get that great of a result. We started using the InspireStar microcurrent, and many of these patients within an hour will get the pain will clear. Also, we discovered that we had to use a higher dose of vitamin C. We used to use relatively lower doses. Now you're using 60 to 70 grams of vitamin C, and they're responding together with a microcurrent in 100% of the cases that we're treating with such fashion, and after adding intravenous ozone. Now, I'm not recommending intravenous ozone necessarily because it has to be done in a way that has a lot of detail, paying attention process to it. You have to pay attention to a lot of details. So the trainings are not many in the United States, and there's safer ways of giving it through saline and blood. But we've been doing it intravenously very safely in patients with low concentrations, without problems with the veins, sclerosing of the veins, and that's been a good thing. And as long as they eat before these processes. If you're doing intravenous therapies, the patients have to eat before they come, because these things will increase metabolism in all patients. Chelation, ozone, intravenous vitamin C, phosphatidylcholine. If they don't eat, they can go into hypoglycemia and you can have a problem. So we had to get to the point because the patients will come to the clinic saying they had eaten, and half of them hadn't eaten anything. They just had coffee and maybe half of a toast. So we had to make them sign what they ate and at what time, and then we'll treat them, because they were saying they ate, they didn't eat. So that's something that I share with you, so you know. Herpes neuropathy, also, it's a painful situation, and typically attacks the patient, and the pain starts even before the lesions start. After 1 hour of microcurrent, the pain is gone and no blister appears in these patients routinely, even with no intravenous treatments. But the long-term treatment of herpes is intravenous vitamin C. And we have patients that if they do that consistently, weekly, an evaluation of their titers every 12 weeks, eventually the vast majority, I'm talking about 90%, I cannot say they're cured, but they go 5-10 years in remission where they don't have if they continue with vitamin C orally and every day, they don't get any more bouts. There's no evidence of disease in the body. So the long-term treatment of that, it will be vitamin C, intravenously and orally. Chemotherapy-induced neuropathy is a big problem in Puerto Rico. Very painful, fit in the hands, does not respond well to analgesics, and is associated with cisplatin and carboplatin. There is a randomized study that I apologize because I couldn't get the reference. I've been trying for weeks to get it, finally got it today. Casino, CASCINU, JCO, volume 20, 2002. They treated 400 patients with gastric cancer in a randomized study, giving them intravenous glutathione before the chemotherapy. None of them developed neuropathy versus 90% of the patients that did not get glutathione. So I could not get the study. It was very hard to get. And now, that's why you don't see the reference here. So we treat patients with phosphatidylcholine, glutathione, and B12, and they have all responded very well within a week or two to reversing the pain of neuropathy. And neuropathy with no apparent cause also responds very well to this protocol. ALS, we don't have a good result with ALS. We only had one patient of all the ones that we saw that did 3 times a day of phosphatidylcholine for 15 treatments in 1 week. And for the first time, her vocal cords were paralyzed. She had to sleep sitting up because she would choke if she was lying down. And at the end of that week, she spontaneously lied down in bed and slept all night and started to utter vibrations from the vocal cords. But she was tired of the injection. She was tired of the disease was taking a toll on her, and she stopped after the second week. But this is something to look into in the future. It's also very costly to get the phosphatidylcholine, so that's a burden on the patient. But it's something to look into for ALS in the future, 3 times a day, 15 times a week. With a med port, we will have to put a med port in that patient, and for several weeks to see what happens. That's something, is a project that we have pending. But other than that, we haven't had success with this. The side effects of these treatments are temporary dizziness if they don't eat, extravasation and burning that will last days, weeks, and sclerosed veins temporarily in 4% of the patients. So the phosphatidylcholine, you got to make sure that that's in the vein because it burns. It's a fatty acid. It's an acid, so it burns a lot if it comes out of the vein. Autism is seen in 137 in Puerto Rico. Now we're seeing the figures going out to 1 of 17 kids in Puerto Rico. 1 of 59 in the U.S. is being projected of 1 of 35 kids. No figures were presented in the CBS website since 2008 until recently. 2 years ago, they started reporting again. It's a rapidly rising epidemic, may be related to aluminum and mercury in vaccines, but I think that's a trigger. It's not the cause. The cause is the pollution that is widespread in the planet. These things are the trigger. When you inject a kid and there's not the protective barriers of the mucosa, you're putting it invasively, parenterally, that's the trigger. Because most of them report the symptoms within 24 hours of injection of a mercury or an aluminum-containing vaccine. So we managed 75 patients only with the phosphatidylcholine, B12, glutathione, and phenylbutyrate, and other things like amino acids, vitamin C, intravenously, depending on the situation. And all of these patients were either from Miami or from Puerto Rico. 7 did not complete treatment. Of the 68 remaining patients, we're doing a retrospective review here. 75% were triggered. They were all talking before they had the autism, but they started not talking at 18 months of age. And this was related in 75% within 24 hours of receiving the vaccine booster doses of 18 months. We tell them to eliminate sugar, complex carbohydrates, and start a nutritional alkalinization with the pH paper, the way I showed you to do it, and intravenous phosphatidylcholine once a week, glutathione 400 milligrams a week, methylcobalamin 1,000 micrograms a week, and folic acid 4 milligrams a week. After 10, 20 weeks of treatment, IV phenylbutyrate from 100 to 400 milligrams in 100 cc of D5W. And we continue if there's a steady improvement. I tell these patients it may take years to get better. It's not months. But if they continue to get better week after week, month after month, no matter how subtle it is, we will continue. As you can see in the blue, we see the symptom and how many of those patients got better. Eye contact, all of them got better. Connecting with other kids, all of them got better. Wait. Verbal commands, most of them got better, the blue. Voicing, most of them got better. Started verbalizing, and better at school, all of them. Now, the one that gets better last is being able to speak. Most of these patients are not able to speak. So I believe that the most sensitive part of the brain in a child is the one that produces the sounds, produces the speech patterns, because it's the last one to recover. And the patients and parents have given me permission. These parents had these two kids that were autistic, meaning they had no language whatsoever. They could not go to a restaurant together. They could not sit together. They would not smile, interact, and they would self-mutilate, both of them, constantly. So it was really hell in this family. And we managed both of them. This is after 4 months of treatment. They're already starting to speak in Spanish and English, both. They're starting to sing. They're starting to go out to restaurants to eat. And the kids are going to a normal school now. So this is what you can expect in patients that are treated when they're still less than 10 years old. When they're more than 10 years old, it gets harder to get to reverse these brains. But when they're 2 to 3 to 4, 5, 6, 7 years old, the results are if you're persistent and tell the parents it's going to take months to years, be patient, but they're going to continue getting better. They do get better and reverse the can reverse the situation completely in most patients. So that's very encouraging. This is another patient. They gave me permission. This is before treatment. He had absolutely no visual, verbal interaction with other human beings. The parents will just put him in little horses and try to get him to interact, but no interaction whatsoever. And then, this is him interacting. He has friends at school now. Wait, I'm trying, oh, I got the wrong one. And this is him. He would not let anybody touch him, and as you can see, he's looking at the camera. So he's already interacting visually. He's there. When these patients start getting into these protocols, they go from a blank stare to a live stare, because the connections and the neurons are waking up. So you're getting more connections to the face, more innervation of nerves. So you're getting more movement in the face. They look more alive because they get areas that they're moving that were not moving previously. So that's what you want to see. Frederick's ataxia. There was some improvement of these patients, fine motor movements and energy levels, but it was too early to tell because they finished after 2 treatments. So in conclusion, phospholipid therapy can reverse the pathologic features of autism and other neurological diseases. Phenylbutyrate seems to detoxify the brain and has a calming effect in all patients. 1 to 2 years of therapy may reverse all symptoms completely. And this is for autism, minimal side effects, allergic reactions and itching in 1 patient. Worsening of symptoms occur also in 1 patient. Hypoglycemia that is prevented by eating before therapy. And thank you very much for your attention.